Bites and stings. In this chapter, you will learn about animal bites, snake bites, insect sting, and bites. First of all, we learn animal bites. Animal like dog, cat, monkey, mangoes, horse, etc. Any bites of animal or human that break the skin needs special attention because it carries a high risk of infection. Many animals, including dog, cat, monkey, fox, rat, cow, jackal, many carry germs of rabies. Rabies is a viral infection that targets the brain and nervous system. It is very dangerous. A person can catch rabies when being bitten or scratched by the infected animal. If not treated urgently, the disease is lethal. All victims of dog, like cat, monkey, jackal, bite or scratch need to be referred immediately for further treatment and follow-up. So what do I see and people? You might see following on a person that has been bitten. First of all, bite marks, puncture marks, if his skin is broken, scrapped skin, moderate to sharp bleeding, local swelling, redness, pain. What do I do? हम क्या कर सकते हैं? Safety first and hygiene. इसको ध्यान रखेंगे हम लोग. Make sure the area is safe and the animal cannot bite on you or injured person again. Wash your hand before and after taking care of patient. Use soap and water to wash your hand. If no soap is available, you can use as to wash your hand. Alcohol-based sanitizer can also be used if available. Put on gloves if available. If not, you can also use the clean plastic bag. Try to try not to come in contact with the injured person blood or water. Provide first. Flush the wound immediately with lot of clean water and then wash the wound with the soap and water or a detergent for 10 to 15 minutes. If available to remove the rabies virus from the wound, wash with provide wash with povidone, iodine, albumin, betadine, so on, if available. Washing is also necessary when a person is leaked, stressed, or has aversion available. If the person is severely bleeding, stop the bleeding by applying pressure to wound. Do not cut the wound plaster. Do not put herbs or unclean material like chili, oil, petrol in or on wounds. Cover the wound with a dry clean cloth or bandage. Refer the person to healthcare facility immediately for further treatment. I see. Wash your hand after taking care of patient. Use soap and water to wash your hand. If no soap is available, you can use acid to wash your hand. Alcohol-based sanitizer can also be used. In fact, hygienic process always apply with patient and yourself. When to refer to healthcare facility, a person bitten by a dog or any other animal should always visit the nearest healthcare facility. Any person who has lived, scratched, or suffered abrasions from the animal should visit the healthcare facility. And other type bites like snake, uh, there are more than 2,500 different kinds of snakes. The effect of snake bite vary accordingly to the type of snake. No, keep in mind that not all snakes are poisonous. Not all poisonous ones are lethal, but one should always be careful handling snakes. All snakes bites should be treated as if they are poisonous bites. Snakes rarely sting when do not disturb or threaten. What do what do I say and why? If a person has been bitten by the snake, you might be observed. Bleeding, swelling, brushing, pain, numbness, weakness, confusion, affected vision, affected speech, nausea, cardiac arrest, difficult. So many characters be observed. First of all, we know safety is first. Make sure the area is safe before you assist the person. The injured person urgently needs help. Shout or call for help if you are alarmed, but do not leave the person unattended. Ask the bystander to seek help or arrange urgent transport to the nearest healthcare facility. Tell him to come back to you to confirm if help has been secured. Comfort person, help the injured person to lay down and tell him not to move. Other comfort at the keep the person calm but do not forcibly restrain him. Keeping calm and not moving well, slow the spread of the venom. If safe to do so, check what type of snake has bitten the person. If possible, note down the features of snakes. Do not lose time. Do not lose time chasing the snake. The person needs urgent help now. It is difficult to assess whether the snake is poisonous or not. Therefore, always assume that the snake is poisonous. Watch the person for any change in his condition. Put on gloves if they are available. If not, they can use a clean plastic bag or cover your hand. Try not to come the contact with the person's blood. Do not strike or cut the venom out of his skin. Do not rub hard to the whites. Do not apply tourniquet. Remove any ring, watch, tight cloths, and may cut off the blood flow because of swelling. Try not to move injured limbs and eventually apply the splint to immobilize the affected part. Cover the wound with a clean cotton cloth or bandage. Once action is obtained, help has been taken, stay with the injured person until help is available. Observe the condition of person, consciousness, breathing, arrange urgent transport to the nearest healthcare facility or hospital. What do I do if the person is unconscious but is still breathing? Put the person in the recovery position. Continue to observe the victim and check his breathing. What do I do when the person is stopped breathing? Perform CPR. Do not interrupt the resuscitation until the person start to wake up, move, open his eyes, and breathe normally. Help arrives, help arrives and takes over. You become exhausted to continue. The sense become unsafe for your people. What do I do when venom gets into the eyes? Clean eyes with water. Drain the eyes for 10 to 15 minutes with clean water. Pour the water from the nose outward. What do I do when the person written in legs? Immobilize the leg by the bandage into the other leg. Splint leg with snake bite wound. To do so, gently bring the good legs to the victim. Use a stick to split the limbs and bandage into place with cloth or cloth. What do I do if the person written in arm or hand? Hold arm still, tell the injured person to immobilize the injured arm himself by holding it close to the body. If it cannot be done due to any reason, immobilize the arm with triangular bandage. What do you do when you are beaten and you are alarmed? If possible, try to move a little possible and shout for somebody to come to help you. Removing watch and jewels from the vital links. If you need to move to find help, restrict the movement for the limbs that has been retained as much as possible and try to live bricks movement. Go to the nearest place where somebody can help you. Always seek medical help. Hygiene, as usual, when to refer to healthcare facilities. Always urgently transport to snake bite victim to nearest healthcare facilities. If animal and snake bite other than bites by insect and insect stings, then most insect bites and stings cause a small reaction that are confined to the area of the bite or sting. Local reaction then can usually be treated at home. Insect sting inside the throat are the dangerous due to the potential swelling and can be life-threatening. Mites and ticks and leech are found in masses and jungle. They are attached themselves family to the skin. Mites and ticks might carry typhus and may transmit into the person. Ticks may also transmit the Lyme disease. Leech are mostly harmless but suck blood from the victim. The effects of sting from scorpion or bite so spider vary according to the height to the type of insect. Note that not all insects are poisonous. Keep in mind, all insects are not poisonous. What do I see and inquire? If a person has been stung or bitten by a insect, you might observe pain, swelling, redness, rashes, itching. Some animals stay stuck onto the skin. Some people experience an allergic reaction to the skin. The reaction can be localized or systemic. A systemic allergy reaction required immediate medical attention as it is potentially life-threatening. A person with a systemic allergic reaction may also the following symptoms: rashes, itching, whistling, hoarseness of voice, difficulty in breathing, dizziness or feeling faint, difficulty of swallowing, a swollen face or lips, nausea, vomiting, diarrhea, confusion, anxiety, or agitation. The effect of bites or stings from scorpion or spider varies according to the types of animal. Note that not all insects are poisonous. क्या करना चाहिए? Safety first. Make sure the area is safe before you assist the person. If you are in area where the wasp or hornet is still around, walk calmly away to a suffer area with the victim. If attacked by the swarm, run away as fast as possible and seek shelter indoor, like in a car. So ask the person to keep calm. In case of V or BAP system, removing the stings of V, leave their sting behind quickly quickly as possible can help to keep and bite small. Use a fingernail, the ease of the bank card or whatever then standard material you have at hand to remove the sting. This can be easily done by the pushing apart from the underneath the sting side in a sliding position. In case of tick bite, remove ticks using fine tweezers, not with finger, and Grab the stick as close to the skin as possible. Pull to firmly up until the stick mouth part have been removed. Do not twist or jerk the stick is removed. Do not use petroleum jelly, alcohol, uh, litmus, cigarette, or any other methods to try to do it. In case a leech white, if you find one leech on a person's body, check the entire body as there may be. Slide a fingernail to edge of bank card or whatever thin steel material you have at hand. Under the sucker mouth, the smaller head of the leech and split into of frightened. Do not squeeze the leech. The person may also consider the leech to fill up and fall off by themselves. Do not put salt on the leech or burn it, as they will need the leech to vomit back into the one before fall. Leech bite tends to bleed or a long time apply to a small bandage and change it regularly. Wash the sting or white sides and wipe away any venom. Do not stick or cut venom out the skin. Do not rub hard or on the white. Use ice if you have it to cool the white or skin. Wrap the ice in a cloth or towel so that it does not touch the skin directly. If you do not have ice, use cold water. Do not cool more than 20 minutes at a time. You have raised the legs of person suffering from anaphylactic shock. Hygiene, wash your hand. Same process. Wash your hand after taking care of the patient. Wash your hand with the soap or water. If no soap is available, you can use ice of water your hands. Wash your hand. Alcohol-based sanitizer can also be used effectively. What do I do if the person is unconscious but is still breathing? And same, put the person in the recovery position. Continue to observe the victim and check his breathing. What do I do when person stop breathing? Perform CPR. Do not interrupt and resuscitation until the person start the wake up, move, open his eyes and breathes normally. Help trained CPR arrive and takes over. You become to adjust to continue. The sense become unsafe for you to continue when to refer the healthcare facilities. If the person condition, illness or the pain does not get the better or get worse, always refer the person healthcare facility.